Right, good morning everybody, welcome back to the channel, Motorhoming Fun. I thought I'd do a little video on my health today, everybody. As you know, I've been diagnosed now with an overactive thyroid, Graves' disease, and I'd just like to go through with everything from the start when I began to feel unwell and to the current day, which is Wednesday the 7th of January. Well, I'm going to tell you, it probably all started possibly beginning of December. I started feeling unwell in myself. First of all, hadn't been sleeping well for a little while. This has been going on for probably a few months, to be honest, actually, but you don't think nothing of it. As you know, I've got shoulder problems anyway. I've got waiting for a new shoulder joint. I've got back issues, so sleeping wasn't good at the time. So we thought nothing of it, and then other things just started to happen, and that my head didn't feel right, and that I come off my strong painkillers for my shoulder and my back because I'm getting this what they call brain fog, confusion, anxiety. So as I say, that was all happening, and another symptom was I wasn't feeling the cold. It's winter, heat sensitivity. I'm still wearing shorts. You can probably see I'm still wearing shorts now. I'm not feeling the cold. I go to bed, I'm sweating and that, perspiring and that. So that was another thing. Eating, wasn't eating, didn't fancy food, just the odd snack here and there, and that. I put myself on the scales. I thought, blimey Ian, you're losing weight. Well, I would imagine sort of November time I was probably 13.5 stone. Beginning of December, 12 3/4. Weight loss symptom and that. So this went on for a little few weeks and that, and it come to a head as I was writing my Christmas cards. I thought, let's get these Christmas cards done for the neighbours. I got some money wallets to write for the family and that. Well, could I write them? I couldn't. My hands were shaking like this, they were trembling. And I also got a problem with my legs. My legs just felt like jelly. Every time I got up, I just couldn't stand up for almost falling down. And I just thought, it's my back, it's my back. I thought, well, surgery is needed on my back. I know I'm going to have a disc decompression or whatever, discectomy, decompression. I've got a trapped nerve with a numb thigh. And I thought, it's on my spinal cord now. I thought this is why my legs were going like jelly and that. So I arranged to see the surgeon on the 20th of December, just before Christmas. As I say, things weren't right. Bowel movements as well. I'll go and toilet more than I should be. I'm just, sorry about this, but I'm just looking at my notes I've got down as well as I'm looking. And that, having a shave as well, I thought, my neck seems different. A little bit swollen. Thought nothing of it. I thought, well, I got a little bit of a sore throat. I'd also previously been for a flu jab, not a few many days before, and I thought, I've got symptoms here of having the flu jab and that. I thought, so ignored it, thought nothing of it. Also, every time I went for a walk, I thought, blimey, I'm out of condition. My heart seems to be beating faster, going upstairs, out of breath. And all of a sudden, I kept getting all these updates on my watch, on my Apple Watch, saying my heart rate was excessive. Now normally I have checked it before and it's between 60 and 65. Well, it was flagging up about 170, 180, just sitting. I thought, well, this isn't right. So we went to see my back surgeon on the Saturday morning, explained how I was feeling and that, told him about my legs and all that. Well, he said, no, it's not your back, Ian. I can tell you now. He said, it's not your spinal cord, because your spinal cord doesn't go down to where your problem is. He said it stops higher up. Right, so we came out of the Woodlands Hospital in Kettering. That eased my mind that it wasn't my spinal cord, not a back problem. Well, that was a Saturday. We went to bed Saturday evening. All night, I didn't sleep. My heart was almost pounding, bursting out my chest. I got diarrhea as well, toilet problem, hadn't eaten. I thought, well, how can I have diarrhea, not eating, not putting much food inside me? So, my normal wake up time is 4:30, just because I'm not sleeping. I go down, get a coffee and that. I thought, Ian, something isn't right, I said. So initially I took Sky just round the little block for a little walk. I come back, had a Weetabix, that's as much as I fancied. I thought, I've got to take myself off to hospital. So this was about 6:30 in the morning. I rang my mum, told her, Mum, I don't feel well, I'm just taking myself to hospital. So we got in the car, 6:30, got to the hospital about 6:45 in the morning. I don't know how I drove myself there, parked the car and that, but I did. I got myself into the hospital, checked myself in, and within 2 minutes they took me in a room. They could see things weren't right, I wasn't well, and that all of a sudden they said take my top off, so everything come off. They put all these sticky pads on me. So we had an ECG first. Done the ECG, well, first of all, the paper didn't feed in right, so that went all wrong. So they'd done another one, ECG, and that they did tell me the results of that straight away. And that they also done a blood test, and that was pretty instant. This was all within 10-15 minutes of going into the A&E, so got no complaints there from Kettering General Hospital and that. And then we was took down to another department in the hospital further down the corridor, where we went down there, checked myself in, and then I got called into another room, which we done another ECG. So at that point we'd had 3 ECGs, and then we'd had a blood test and all my obs checked and all that. Well, my blood pressure was sky high as well, and that, so that wasn't a good sign neither. And then they sent me down for the chest x-ray. So we come back from that. Well, we sat in the waiting room probably 2.5 hours, maybe 3 hours. And then I got a call from the doctor saying, could we do another blood test? So we had another blood test done. So this was probably about 6 hours in total from arriving at the hospital, as I say, and that. So we had a further blood test done. Obviously we was in the middle of the doctor's strike as well, so things were running a little bit slow in the room. And then we finally got a call in to see the doctor, the senior doctor. And then he went through a few things. He checked my neck, felt my neck and everything, felt it was swollen and everything, and that not as big as he'd seen. He said, but yes, you have got some swelling there, you are tender. And he then went on to show me his computer screen, where he got 3 sets of blood results. And he said, basically, Ian, he said, you haven't got a heart problem. He said, but you've got an overactive thyroid. He said the levels at the moment are 5 times higher than what they should be, and that, which was, he said, is as high as he's ever seen. He said, but he said, what we need to do now is get you on medication straight away. So what I'm on is a beta blocker. He put me on a beta blocker straight away. I had to go to the chemist on the way home. Luckily, I got there before 4 o'clock and the chemist was still open. And we're on these beta blockers, propanolol, which is 2-3 times a day, 20 mg. And also we're on this carbimazole, and that is the thyroid tablet. So all in all, that eased my mind. We got back home, had a settled night, and then the following day I woke up pretty good, knowing that I'd been in hospital, and I knew what was happening to my body now, why I was having all these problems and symptoms. Well, when I was in the waiting room, I read up the symptoms on overactive thyroid, and they were true to word. They were basically everything what was said was true. All these symptoms read right, and I thought, yes, Ian, that's what it is. Now, I think this has been going on a lot longer than the last few weeks. I think this has been a gradual little increase over the last few months. Probably from the summertime, I've had these little symptoms, not eating. Obviously, the sleeping was an issue as well. Muscle aches, weakness, even muscles in my legs and arms just didn't feel the same. Tiredness and that. I could probably just sit like now and think, I'm going to have a 5 minute skip. So sometimes we did after lunch and that. So anyway, I woke up that morning, and within an hour I got a phone call from Kettering General Hospital saying, could I come in this afternoon for an ultrasound on my throat? So that was about 3:30 that was booked in for. So we got myself up there, and that we had the ultrasound. That took about 5-10 minutes to do. They were quite thorough, they were, and that with that. And then we didn't hear no more. Then the next day, I think I just got a little envelope come in the post, and it got a little blood test envelope in it saying, could I get a blood test done prior to Christmas? Well, if you know Northamptonshire, it's probably the same around other parts of England. Getting a blood test is quite hard nowadays, but I struck lucky. There was one about 10 miles away at a local clinic. There was just one showing, so I grabbed it. That was Christmas Eve, about 10 o'clock in the morning. Go and get the bloods done. And that, so we got the bloods done. We thought, great, we're feeling a bit better now. Been on the medication 4 days. That was Christmas Eve, that was. Well, Christmas Day, I woke up. I was no good to anybody. And that, it was all arranged. I was going mum's for Christmas. Mum's 83. My sister was going Dawn. My nephew Jaden. And we're going to have Christmas dinner at mum's. I did initially say, come to my house, but mum has a job getting up the stairs. So we left it there. We were going to go to mum's, and that, well, I just got no strength, no energy. I felt lethargic. I felt sick. I couldn't eat. I couldn't do nothing. I literally just took Sky round the little block, come back. Couldn't eat no breakfast. Didn't do nothing all Christmas Day. Christmas Day was a disaster for me. Sorry for mum, sorry for my sister, sorry for Jaden. And to this day, everybody, I still haven't opened my Christmas presents. They're here, but I just can't open them at the moment, just till I feel myself and feel a bit more Christmassy. I know Christmas is gone, but I have said to mum, I will do Christmas dinner again once I feel up to it. So that was Christmas Day. Boxing Day went, I felt a little bit better. What I think is, initially in the mornings, I don't feel too good because it's been almost 24 hours since I've had my thyroid tablet. I didn't really know what dose to give me. I'm on 20 mg and that, but to be honest, I think I should be on a slightly higher dose. And by the evening time, or mid-afternoon, I'm struggling and that. I just feel tired, lethargic. And I get this like head confusion, brain fog I wake up with, lightheadedness and that. And it just, until I get that tablet in my system again, as I say, which takes a couple of hours, I'm pretty useless and that. But these symptoms are better than before I went to the hospital. So that was Boxing Day. And then on the Saturday, another reasonable day. And it got to about 7 o'clock in the evening. My mobile phone rang. No caller ID. I thought, who's that? Didn't bother. And then my home phone rang. That was a no caller ID as well. I thought, well, I better pick that up. So we picked the phone up. And they was, all of a sudden they said, this is Kettering General Hospital. Is that Mr. Ian Shaw? I said, yes. Just had to confirm details, address, date of birth, just to make sure everything was who I was. And they just said to me, Ian, can you get up to the hospital on the 2nd of January? We'll require you in for the day and we want to do more tests. And that's so. So that was a Saturday night. I thought, well, obviously things aren't great Saturday night. You think, why are they ringing me on a Saturday night? Things can't be great. Didn't have a great night's sleep, and the following few days were just the same with worry and that. So we got those few days over, New Year's Day over, and that, and then come Friday, January the 2nd, we had an appointment for 10 o'clock. Well, I was at the hospital for 9:30. Luckily, my sister, my elder sister, Yvette, she wasn't at work. She said, Ian, I'll take you. So she took me. We got there, as I say, quite early, and we got called in and that. We got straight into a treatment room. They'd done the normal things. They'd done my obs again, blood pressure, you name it. They'd done that, put the thing on your finger and all that to check your blood oxygen level and that. And they took a blood test. And they said, Mr. Shaw, go away until 11 o'clock. So me and my sister went to Costa Coffee in the hospital, had a coffee. And that time went by, we sat chatting, talked about our holiday and different things, family things and everything. And that we went back down to the room, 11 o'clock on the dot. Well, we sat there. Well, I sat there, she sat there, and then she had to leave the room because the room was busy and they only wanted patients in there. And then we sat there until about, well, I sat there until about 1:45. She was still waiting outside. She was talking to another gentleman. They'd been down to Costa Coffee again for another coffee and a snack for some lunch. And at 1:45, I was called in to see the doctor. And then he said, well, she said actually, it was a young lady. She was a junior doctor and that, but she said, Mr. Shaw, we've had your bloods back. She said, not a lot of change, she says, on your bloods. Yes, your symptoms are better, but she says we've still got big problems with your overactive thyroid. So she said, we'd like to do another test while you're here. She said, we can do it off the existing blood, she said, but we need to check your calcium. So that was another hour gone. We went back in to see her, and that she said, calcium levels fine. And she said to me, Ian, can you take your glasses off? So she wanted to look at my eyes. Well, I'll come to the closer to the camera. And you can probably see my eyes are a little bit bulging. You can see the whites of my eyes more. She said, well, Ian, I'm going to tell you. She said, you've got Graves' disease. Well, that comes a little bit of a shock. I'd read little bits about it on the internet because it's all part of the overactive thyroid, but yes, it come to a shock. Bit of a shock to the system, just being told Graves' disease. Well, just the name doesn't sound right, does it? And that Graves' disease, it sends, signals in your head that things aren't great. But obviously, as I say, that is one of the main symptoms of Graves' disease, your eyes, your bulging eyes and that. So I'd had little problems with my eyes and all that. Even going back 12 months, the optician said to me, Mr. Shaw, go and get your eyes checked. I'm not too happy with your eyes. I've been wearing my glasses a lot more. My vision seemed to be going a little bit, but we thought nothing of it. And that my bloods did come back after the optician said, could I go for a nice eye test? He did say my B12 levels were a little bit low. Well, the doctor said that. And then the report went off to the optician and that. So that was one thing. And then she said as well, Ian, she said, we've looked at your ultrasound and you have got a little nodule on your thyroid, she said. It is benign at the moment, she says, and that, so we don't know long term what the issue is going to be with that. So obviously, thoughts of that is cancer of the thyroid and that, which didn't go down too well, but I'd read little bits about it and I thought thyroid cancer is not one of the worst ones, and with treatment we can probably sort it. So at the moment we're in a little bit of a limbo at the moment and everything what's going to happen. The next thing is I've got to go and see an endocrinologist, which is on the 12th of February, and I've got a blood test on the 3rd of February, which the endocrinologist will read and obviously tell me what the next steps are. Now, long term, I don't know whether we need to have the thyroid removed. That's one option. The other option is radioactive iodine, where it basically kills the thyroid off, and that. There are some risks with that, I'm being told, and that obviously I have to self-isolate possibly for a week or two once I've had it. It's basically a tablet and you swallow it and you are radioactive until it dies off basically, and that. But they're both things what could happen, as I say, or otherwise they might just treat me on medication and that. So as I say, I don't really know what's happening at the moment regarding future treatment. So this is just a little bit of an update from start to finish up to where I am present time, everybody. So I just wanted to just tell you exactly how things were. So as I say, thank you very much if you made it to the end, everybody. If you could give me a thumbs up, a little like on YouTube. Also leave a comment if you could, if you're in the same situation as me or you're going through similar and that, or been through something similar. And also it would help me, everybody, if you did subscribe to the channel for future updates. So thank you very much. A little bit of a long one, 22 minutes long today, everybody, but I just wanted to tell you my complete story. So we'll see you all soon with any future updates. Bye for now.